Welcome all to the yet another session of discussion with the topper. Today we have with us Dr. Lakshay Agarwal, who is actually secured rank 11. It's not a joke; it's an unbelievable achievement for somebody to get rank 11. So congratulations from me and all of the Marrow faculty as well as the entire team. Congratulations on a great effort and achievement.
Thank you so much, sir. Thank you.
So, how do you feel now that the NEET-SS results are finally out? How do you feel?
Sir, of all the things, I am very relieved, and then I am happy and very excited also.
So, what was your first reaction? The reaction was a relief, or yes, or it was yes, I did it.
Sir, both of it, a mixture of both of them. Actually, I was checking my result and I could not. The result part had first roll number and then they had marks and then they had rank. So I had seen my marks first, and then because the percentile is this time the cutoff scores are a little lower, so I had lower marks. So I thought these marks are not good. So I thought before looking at the rank, I thought I've fucked up. Sorry. I have not done good. But as soon as I looked at the rank, then I did know that it was good. And I checked my result 2-3 times before confirming that it is like that only.
Great. I can still see you're still excited. That's great. That's great. So before we go further, can you briefly introduce yourself? Like your MBBS, MD, and what?
I did my MBBS from UCMS Delhi. In 2016, I started my MBBS. In 2022, I started my MD in LHMC Delhi and completed that in October 2025.
October 2025. I hope everybody listens to that. And now it's just 4 months from that, October 2025. Not 4. Yeah, going to be 4 months now. So I understand that we had a discussion and you would like to take up gastroenterology. Now, yes. Before we proceed, would you, what motivated you to take up the think about the super specialty branch?
So honestly, I was interested in intervention right from the beginning. I liked doing procedures. I liked doing interventions, and they're very satisfying as well. The results of interventions are satisfying as well. So I had 2 branches in mind from the starting of my MD, cardiology or gastroenterology. But as I went to the residency, I skewed more towards gastroenterology. Maybe because I was initially posted in a department where I could see endoscopies and colonoscopies being done. That is one of the reasons.
So technically, it is basically what you say is, the seniors, people in the gastroenterology department inspired you to, you like them and you saw them and you liked it. That's what you mean to say.
Yes, sir.
Okay. And so now you saw, you got that, you like that, and then you had a vision and you worked according to it. And that's probably that's the reason, and you had a single-minded focus as to how to go about it. Now let us discuss it. When did you decide to prepare seriously for this NEET-SS?
Sir, I had, to be very honest, I had AIMS NEET-SS in my mind. So I started preparing per se for the entrance examination during my final year of MD examination. But I had been reading medicine per se from the second year theory. I could not read much of theory during my first year of MD because we were busy in ward, emergencies, OPDs, and managing patients. So could not get time in just 2 or 3 cases, whatever I feel I could not manage, I might have seen. But I started reading and preparing during my second year of MD examination. And that too, during my second year, I focused more on the wards, emergencies, and rounds. Whatever patient I had admitted, I used to study about that patient, going back from Harrison or from Marrow videos. Those made understanding Harrison a little easier. A person reading directly from Harrison might not understand as much as if you've seen Marrow videos, and then getting back to Harrison makes it a little easier to understand what Harrison wants to convey.
So here I would like to just pause here and just let everybody know that you do realize that he finished his MD 4 months back, but his preparation was not for like 2 months. Like he finishes October, November was INI, and December was NEET-SS. So when you look at it, the preparation has not been for just 1 month or 2 months. It's been for 2 years. And if I'm not wrong, it has been a consistent performance over 2 years, 2 to 3 years, that led him to be where he is right now. So of course, when you said that first year was very difficult, of course, first year is going to be very difficult as an MD student. It has been really difficult, sleepless nights, and for fasting, and probably you must not miss many meals as we have all done in first year of
Right.
MDs. So in this, what was the most challenging phase you had? As in, then suddenly you had to stop. See, when we were studying, like, it was similar to you only. First year was complete work. You don't think about it. You just have to, just put your head down and work. And suddenly, second year, you decide that you have to decrease your work, or inculcate a certain amount of studying also. So
Yes.
that's a bridge we all find that difficult to go along hands, go along through together, because you have to work as well as you have to study. And this work in the second year probably is more of overseeing and a little bit more decisions rather than first years. But still, the scut work is done, but still you have to be there. You have to be there. Along with that, you have to keep studying as well.
Yes.
So definitely there would have been many challenging parts in this second year. I mean, of course, the starting is the most difficult. The inertia is, how inertia is. So unless unless I act upon my external force, you don't move. So what was the challenging phase you had?
So challenging, as you said, the overcoming the inertia is the most challenging one. But once you overcome that inertia, once you get a hang of reading daily, once you get a hang of being good at yourself and being good to your patients, so that you can find out what is the diagnosis. If the patient is involved in the diagnosis has not been made, you can go back and study the symptoms, and all in all, when you find medicine interesting, you like to read it. And the difficult part is overcoming the inertia only. And I was fortunate enough to be blessed with the good seniors, that I was around the people who had secured good ranks, so I was motivated enough to even match their performance.
Brilliant, brilliant. So basically, it's a pedigree as well. And I mean, this is a consistent thing which we have noted for all the interviews. If you look at it, people who have done well, they have always been there throughout. With in the companionships of people who have done before. So
Yes.
it makes the challenge a little less, because you've seen the next person done it. So you
Yes.
feel that you also want to do it. Now, this is one specific question I'm going to ask. Um, what about did you have any phase where you had self-doubt? Would I be able to do this? I mean, uh,
So
technically, from my perspective, when I look at your preparation and the time, I don't think that you had any time for thinking of that, because there's no time. No, everything happened so fast.
So
Actually,
once you read, you don't have much of doubt in your mind. But once you start giving tests, when you know what is the competition, then the doubt kicks in.
yeah,
So I started giving GTs in my final year of examination. So I was doing fine in NEET GTs. So I knew I would secure a good rank, but the kind of target I had in mind, that gastroenterology I had to take, that for that I had to get in top 20. That I was not sure, but I was sure that I would get a good rank. But for INI-SS, I was always in doubt, because getting into AIMS Delhi, you'll have to not just top 10 would not do, top 5 would not do. You'll have
yeah.
to be in 1 or 2. So I always had that doubt in mind, because I was not consistent in those GTs. I could score in top 10, but I was not consistently in top 5 only. So I have always had that doubt in my mind, and still it pains that I could not get into that.
But that probably was your first exam. You have to have
Yes.
a prior, what do you call it? A placebo, test ball before you start off with the trial ball. That's what it is, trial ball.
Yes.
So, see, you had studied during your second year MD. It's very difficult to do that. Would you mind telling us how you structured it? As in, obviously,
Sir, there were two strategies that I had in mind. should I go unit wise? Should I complete cardiology and then move on to neurology and so on and so forth? Or should I be like that? I should see patient in ward and then read according to the patient in ward. So I did a mix and match of both. I used to read about patients also. So when I thought that I've read kind of similar patients are coming, like for example, COPD, heart failure, stroke, these CLDs, these are the patients which may form the chunk of the patients in any of the MD internal institutes. So when I had read about most of them, then I went on to complete my studies according to the units. So I went on to read cardiology, gastroenterology, neurology, and so forth. So I always like to read Harrison. So but many a times I could not get what Harrison was saying. So just like I said, I used to watch Marrow videos, and then I used to go back to Harrison, and if I could get some points, I used to add it to the notes that I would like in Harrison. That is
When did
how
you?
I.
Okay, go on.
So
When
that
did
is
you
it.
first start? When did you first start using Marrow? And then when did you first start this?
So as soon as my first year entered, I purchased Marrow subscription, and then
Okay.
I started reading it, gradually increasing the hours as the time went.
So pretty much your plan was very clear, clean. That's pretty good, man. As in, that's again something which is very consistent amongst the rankers, top rankers. The idea that you fix your focus first and then just work accordingly. And before you start off thinking, what am I going to do? If you are clear about what you're going to do, you kind of work towards that goal. If you have multiple goals, it's difficult to get where to go, what to do. Difficult, but once you have a moment of clarity, I'm glad you had that moment of clarity much earlier in your this thing.
Yes.
So, like you said, you found the grand test the most helpful. Apart from
Yes.
that, would you say that a conceptual based studying was better than for the grand test per se?
Yes, sir. Definitely, conceptual based learning is better than rote learning. It also helps reduce the amount of revision. If my concepts are clear, I might not get a time to revise the same thing. But using those concepts, I might arrive at the answer if I had not revised, because the syllabus is so vast, you cannot revise each and everything before the exams. So if the concepts are clear, they help to pinpoint the right options, because the four options are in front of you. You just have to rule out. If the concepts are clear, you can rule out pretty much.
So, so was it? I mean, you had the structured notes as well. Do you think the videos were better or the notes were better? I mean, did you go together or as
So,
in? Tell me.
so most of the, matlab, I did not just read notes. Whatever part of whatever subject I prepared from Marrow videos, I used to see videos. I did not just read notes.
Okay, cool. So, I mean, apart from this, what do you call it? Studying for MDMS per se, this studying for NEET-SS. Did this? Do you think it helped you in routine clinical management of patients?
Sir, as I said, I did not specifically prepared for NEET-SS. I was preparing for. Uh, I was reading all of the illnesses. I was reading about the patients. So it was helping only just in the last 4 5 months of my MD. Before preparing for the MD final examination, I used to give GTs. So pretty much it was same as I was managing patient, or I was giving NEET, or for that matter giving university examinations.
So I'm glad that it's like you had decided to place your trust some in one place, and then you went according to that. That's what I also keep telling students who ask, which is better, what is better. You just have to choose one and stick with it, whatever it is.
Yes.
You have to have your way clarified. You have to be clear about how you're going to do it. So the I mean when we when I was writing exams and all, we used to write multiple exams. It's not one single exams. So we
Yes.
had multiple exam days. So like you have just two exam days, we had multiple, like 10, 15 exams you used to write. So by the time we finish, our strategy would kind of get solidified after the third or fourth exam. That is when we'll, have a trial and error method. So of course, the exam day, the day of the exam is the most important day.
Yes, sir, definitely.
Would you remember that day enough to walk us through the day? As in, what was just, obviously you would have had bouncers in the questions, of course, there has to be. So how did you manage to keep a cool mind during the bouncer
Sir,
duties?
in my INI with the day which I went, I gave INI exam. So I was a little short of time. So I was prepared for the NEET-SS examination. The main goal of the main goal was to not be short of time. So I was of the strategy that I should finish my exam in the given amount of time. I should not feel that I could not give time to easier question. I could not give time to easier question, and I stayed on the difficult ones. So my strategy was simple, that I was what however difficult exam was, I had to finish it in time. I had to keep looking at the clock also, and I had to finish. I don't want to give more than 1 minute to a particular question, however difficult it is. I can always come back at the same question if I finish the test in time, instead
That's
of
perfect.
doing easier questions bad.
Yes, that's a very important advice that I've the newer aspirants should take, because recently, if you notice, there was a interview given by Roger Federer. Not interview per se. He had a convocation speech by Federer where he said that you play a ball, even if you lose it, your mind should be on the next ball, not on the ball that is gone. You have
Right.
to play the next ball as if you're playing the first ball. So
Yes.
that's pretty much the strategy you also used. And
Yes.
of course, with Federer, it's a winner. So no wonders there. So now I think we will kind of wrap up kind of things. Would you what before that I would like to ask you one question, which is probably a little difficult. Would you think you could tell? Or could term around 3 misconceptions about these exams?
Difficult misconceptions. The only misconception, I think people might think that it is difficult to uh, get a rank, good rank 20, 30. What I feel is, if you are fair to yourself, if you're done fairly good during your MD, if you're done good, if you read everything, it is easy to get a rank like that. It is not something that you cannot do.
I think that is a very important message Dr. Lakshay has given us. Thank you for that, because that should inspire a lot of people to do this. I think we can wrap it up. Thank you. Thank you, Dr. Lakshay Agarwal, for sharing your honest insight. This is a very honest interview. Thank you for that.
Thank
This interview is actually very short, very nicely captured the success of story of yours, which just underscores that it is not about perfection, it's about persistence. It's about
Yes, sir.
persistence, it's about clarity, it's about consistency, and of course, smart resource use. Of course, your story, your this thing is going to definitely energize and inspire people coming behind you. And of course, like how you have been inspired by people
Definitely, sir.
in
Before
front
me.
of you. You have kind of what you call paid it forward to the people coming behind you. Thanks a lot.
Yes,
Thanks a lot for joining us. It was a pleasure talking to you. Probably we'll meet up sometime in some of the conferences here and
definitely,
there.
sir.
The time we'll meet up. Thank you.
Thank you so much for having me, sir. Thank you.
Bye.